Well, there's a few, and they're kind of changing because the technology is changing an awful lot. But the responsibilities you have, you're deploying technology in healthcare. If I sort of break it into different areas, and we can go into each of them, you've got data protection. And in the UK, we have the Data Protection Act and GDPR. It's the same in Europe, and around the world, there are different data protection standards. That's critically important. Healthcare information is extremely sensitive and very valuable to the person for providing care. And they have rights and we have responsibilities about handling that. So handling data protection is critical. And actually people have a general sense of that because there's mandatory training on that too. They maybe don't know as much, but that's often put in place. And so in practices, if you're working in a practice and you're using technology, you'll want to make sure that you have a list of your technologies, you'll have data protection impact assessments and data processing agreements with the people that are doing this. It's often done by the commissioning organization, but actually if you're commissioning something yourself in a practice, you're going to want to address that. And bear in mind, the practice is the data controller here. And that means that you have quite stern responsibilities that if you don't deal with them, can attract very large fines. And practices, if you're in a general practice in the UK and they're a partnership, these are unlimited liability partnerships as well, meaning that that fine could swoop in and not only cost the practice, but cost the partner as well. So I think people are aware of data protection a little bit more, but that's definitely one that you have to be aware of. Clinical safety is the next one, and that's the one that I care about very much because this is about making sure, or clinical risk management, making sure that the technology that you use is safe to use. That starts with saying, what does the technology do? Who does it do it to? And where does it do it? So what does it do? The manufacturer needs to say, this is what we're doing. And you systematically work out what could go wrong and what controls or preventions you put in place and how you've evidenced it. So you can say as a manufacturer, yes, if you use it this way, it's safe to use in care. But in the UK, particularly in England, there's another side for the deploying organization. It's called DCB. The 0129 section is the manufacturer. 0160 section is for the deploying organization. And you basically say, right, I've got this technology that I'm going to use for my patients, maybe like a scribe. Manufacturer says I have to use it this way. Can I use it this way? Is my practice any different? Am I going to be able to train everyone? Am I going to be able to monitor it to make sure that if things go wrong, and things always do go wrong in some way, how do I minimize any harm and learn from it? Clinical safety is the bit that I mentioned earlier on that was legally required in England. And many people don't know about it. There's endless discussions as to why that's the case. But you need someone called a clinical safety officer who's a registered healthcare professional, currently registered, who has training in clinical risk management. And that's the big gap at the moment because practices don't often have these. They don't need one of their own, but they need to know whose theirs is. And that's the person that helps manage this risk management. So that's the clinical safety side. Cybersecurity, we mentioned a little bit earlier on with Guy's and St. Thomas's. That's often done at a commissioning body level, but practices need to know about making sure that people have the right passwords and smart cards and aren't installing applications that they shouldn't just in case it causes problems. Medical device regulation is the bit that people sort of think about a lot, which is this software doing something that would make it considered as a regulated medical device? And all around the world, there are different rules. The UK is close to what Europe has as well here. But basically, if this is software or anything that performs a sort of diagnostic, therapeutic, prevention, or prediction, a management task might be considered a medical device. And there's a lot of certification that happens with that. Practices want to know that. And then there's a few other things on top of that. I won't go into them in all the detail, but it's about how they integrate with other systems, whether they're usable for all people, not just a small group, young and old, different demographies and so on. Those are all in there. So it does feel very overwhelming for practices and people that don't know it. But it can kind of be boiled down. And it's actually quite similar to what practices do right now for managing their staff and their prescribing and so on. So a lot of the work that we do with the people that we help is about trying to wrap it in and get people to feel that it's not just like another huge headache. It can be part of what they do.